Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.com and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary, for the medical knowledge to general people and for reference to medicos. Today I am going to discuss about the syphilis. Syphilis is a venereal disease very common in sex workers and partners. The incubation period of acquired syphilis is 10 to 90 days. It is caused by the organism Treponema pallidum, otherwise called Spirocheta pallida. Clinical features. In acquired syphilis, the clinical features are divisible into three stages. Primary stage. In majority of cases, the primary sore or chancre is one of the genital organs. In the male, the chancre is obvious, but in females, the primary sore on the inner aspect of the vulva or on the cervix is often unnoticed by the patient, but the infection is likely to progress well into the second stage before its real nature is recognized. Extragenital chancre occurs on the lips, usually upper lip, the tongue, tonsils and anal margin, nipple, fingers and rarely in other situations. Primary sore on the lips usually result from kissing. Dental surgeons and obstetricians are particularly prone to get on fingers, but now it is less owing to the usage of gloves. Primary sore is due to inoculation through the minute abrasions and is first noticed as an indurated papule. Associated endarteritis leads to ulceration and a typical Hunterian chancre develops. The ulcer presents a definite margin with characteristic induration due to lymphatic infiltration. In case of vascular structures such as the lip, considerable edema of underlying tissue is present. In some cases, the chancres are multiple, maybe due to infection of two or more abrasions or owing to auto-inoculation of an opposing surfaces by primary sore. The regional lymph nodes are enlarged form, the skin is not red and without tendency to suppuration. In penile chancre, the dorsal lymphatics can often be palpable, wiry. In some cases, the initial papule disappears without ulceration and the patient is unaware of its presence. If phimosis is present, secondary infection sometimes supervenes and the ulcer becomes acutely inflamed with secondary acute lymphangitis and enlarged and tender lymph nodes. In virulent cases, phagedena, an exudating ulcer may develop. A primary chancre is to be distinguished from the traumatic ulcer, a soft sore, an early epithelioma, herpes or any other lesion on the genitalia. Secondary stage. From 2 to 12 months after infection, the lesions occur and are typically generalized and symmetrical. The Wassermann reaction is strongly positive. The general manifestations of the secondary stage include malaise, anemia, fever and generalized enlargement of lymph nodes. The epitrochlear, suboccipital and posterior cervical lymph nodes are liable to be affected. The character of the syphilitic eruptions are dull red or copper color. The absence of irritation, symmetrical distribution and the polymorphic nature, that is 2 or 3 types of rash present simultaneously. Papules appear at mucocutaneous junctions as the anal margin, vulva or the angle of the mouth or where cutaneous surfaces are in apposition. As a result of the situation, these papules become sodden and frequently form large, foul grayish masses which are termed condylomata. Later, feeling bone pains, osteoscopic, or periosteal nodes are in evidence. Transitory and symmetrical effusions may occur in the large joints. Iritis sometimes occurs and give rise to pain, lacrimation, congestion around the cornea, sluggish and irregular pupil, and the color may alter due to edema. Tertiary stage. This stage starts about 3 years after the infection. It may last throughout the patient's life. The characteristic pathological changes are either diffuse gummatous infiltration or local gumma formation. Any structure in the body may be affected. In some organs, both changes may occur. A gummatous arthritis is sometimes associated with a local gumma, and a cirrhotic liver may harbor gammata. Gamma. A gamma is a mass of necrotic tissue surrounded by granulation tissue, beyond which a zone of fibrosis, necrosis of tissues is partly due to toxins and also to direct blood supply, result of endarteritis and surrounding fibrosis. If not treated, gamma enlarges and softens as necrosis extends. It is near the skin, hyperemia and induration are evident. The center of the indurated area then softens and breaks down. The gamma discharges and typically a washed leather slough is seen at the bottom of the cavity or on the floor of the ulcer, which is painless. The edges are characteristically sharply cut and circular in outline. The gummatous ulcers following subcutaneous gammata are especially common on the legs, back of the thighs, forearm and face. A healed gamma leaves a tissue paper scar which is silvery, supple and serpiginous, sometimes surrounded by a pigmented area. Investigations. The trypanoma can be discovered in serum obtained by scraping primary lesion. If enlarged lymph nodes are present, if lymph can be aspirated with a fine needle and examination will reveal spirochetes. By means of dark ground illumination, the trypanoma is seen as a spiral organism resembling a corkscrew in appearance, with about 8 spirals, and the organism is about 8 microns in length. Wassermann reaction, a complement fixation test which employs an antigen prepared artificially from normal tissue, is usually positive in untreated cases about 2 weeks after the appearance of the primary zone. Treatment is not delayed till the test is positive, but commenced immediately the trypanoma is demonstrated. The treatment instituted while the serum is negative yields excellent prospects of permanent cure. In untreated late primary and secondary syphilis, the Wassermann reaction test is always positive. The tertiary stage, a positive result is obtained in about 90% of cases. If the central nervous system is affected, the cerebrospinal fluid may give positive reaction, though blood serum is negative. In addition to its diagnostic value, the Wassermann reaction is also a valuable control in estimating the efficacy and the result of treatment. Flocculation test, Kahn's test. It depends upon the occurrence of the visible flocculation on an antigen suspension when mixed syphilitic serum. They can be performed rapidly than the Wassermann reaction and are valuable confirmatory. Test may be positive for yaws, glandular fever, and leprosy. Weak reactions may be obtained in miliary tuberculosis, malaria, typhus, vaccinia, relapsing fever, and advanced malignant disease. Hence, it may not be confirmative. Trypanoma immobilization test. T.P.I. depends on the immobilization by an antibody in patients' serum of Trypanoma pallidum suspension from infected rabbit testis. It is sensitive and specific but difficult to perform. Reiter protein complement fixation test R.P.C.F. employs as antigen a protein extracted from non-pathogenic trypanoma. It is nearly as sensitive and specific as the T.P.I test and is technically simple and more suitable for routine use. Treatment. Till the serum is examined bacteriologically, no antiseptic is applied to the suspected shock. A saline compress is applied pending the result. In the beginning, penicillin was used and now supplemented by many other remedies for the disease. It is necessary to maintain a continuous therapeutic level in the serum for 7 to 14 days. Benzyl penicillin, penicillin G, is the most effective type and heal the lesion rapidly. Crosses placenta to reach the fetus and is effective in neurosyphilis. A single injection of procaine penicillin 6 lakhs intramuscularly will maintain an effective blood level for 24 hours. Apart from penicillin sensitivity, a reaction may occur in 6 to 12 hours, which is characterized by fever, headache, bone and joint pains, and rigors. The cause is not known and it has no after effects. Inherited syphilis or congenital syphilis. Inherited syphilis is divided into 4 grades of salivary severity. 4 grades of severity. Abortion after 4th month. Birth of a stillborn often macerated fetus. The infant presents obvious syphilitic features as wasting, sloughs, or skin eruption. The last one is the child is apparently healthy but may develop syphilitic stigmata. The following are important clinical lesions. Mucous membrane. Inflammation of the mucoperiosteum of the nose causes a purulent discharge called snuffles. Mucus patches, condylomata, and gummatous ulceration of mucous membrane and adjacent skin occurs. Skin. The bullous rash is the common lesion known as syphilitic pemphigus, but a roseolar rash is not uncommon. It is the early months usually on the buttocks. Teeth. The milk teeth erupt late and are ill-formed. The permanent incisors are bag-shaped. And are ill-formed. The permanent incisors are peg-shaped and may present a notch. Hutchinson's teeth. The central part of the crown of the first permanent molar tooth is developed especially in the lower jaw. Eyes. Iritis, sometimes accompanied by cyclitis, occurs in young children. The most characteristic lesion is interstitial keratitis, appears between the ages of 8 to 16 years. The first indication is a ground glass appearance of cornea associated with photophobia and lacrimation. Lesions of newly formed vessels appear later. Eye salmon patches. One eye only is affected at first, but the second eye is subsequently involved. Prognosis should be guarded as opacities may remain in the cornea or deep-seated mischief may occur. Here, nerve deafness sometimes develops about puberty and is often associated with interstitial keratitis. Bones. Osteochondritis of the nasal septum is the first manifestation. Necrosis of the cartilage occurs at the age of about 4 weeks, and the resulting discharge causes snuffles. Characteristic depression of the bridge of the nose follows destruction of the support. Craniotabs of the vault of skull occurs during first 6 months as a result of absorption of the bone. Parrots nodes. Epiphysitis, overgrowth and curvature of tibia may be present. Joints. There are 2 types, inherited and acquired joints. Inherited joints are Clutton's joints. Painless effusion. It is described as symmetrical, silent, serous, syphilitic synovitis. The D joint is usually affected and the condition is frequently bilateral, but both joints may not synchronize. The effusion causes a sensation of weakness and insecurity. On examination, the joint is seen and felt to be distended. If effusion is more, movements are restricted. This condition occurs between the ages of 10 to 18 years. Other organs, lungs. A diffuse interstitial fibrosis occasionally involves the lungs. Liver, syphilitic enlargement of the liver and splenic enlargement are also common. Tests for arthritis may be bilateral. Testis. Arthritis may be bilateral and if occurs before puberty may result in impotence. 4 typical lesions start at puberty are Clutton's joints, interstitial keratitis, otitis interna, and arthritis, epitomized as the halt, blind, deaf, and impotence. Treatment. Prophylactic treatment is essential, and as a rule, the mother is very tolerant to treatment during pregnancy. A healthy child is usually the reward of antenatal treatment. Treatment of an infected child should be instituted immediately after birth. A course of penicillin is prescribed in conjunction to cortisone. Should interstitial keratitis develop, that's all about the syphilis, and in the next video I will discuss about some other disease. Thank you.